What is Mpox? Signs and symptoms. Mpox, formerly known as monkeypox, is a rare viral infection primarily found in West and Central Africa. While there has been a recent increase in cases in Europe, the overall risk of contracting the infection remains low. How Mpox spreads. Mpox can be transmitted from person to person through several means. Close physical contact, direct contact with Mpox blisters or scabs, including kissing, hugging, or even holding hands. Contaminated objects, touching clothing, bedding, or towels that have been used by someone with Mpox. Respiratory droplets, inhaling the coughs or sneezes of an infected person when in close proximity. In West and Central Africa, Mpox can also be contracted from infected rodents, such as rats, mice, or squirrels, in the following ways. Bites, being bitten by an infected rodent. Contact with infected animals, touching the fur, skin, blood, body fluids, spots, blisters, or scabs of an infected animal. Consumption of undercooked meat, eating meat from an infected animal that hasn't been cooked thoroughly. Mpox in Europe. Although there has been a rise in Mpox cases in Europe, the infection remains rare, and the overall risk to the general population is low. You are extremely unlikely to have Mpox if you have not been in close contact, such as touching someone's skin or sharing towels, clothes, or bedding, with someone who has Mpox or show symptoms. You have not recently traveled to West or Central Africa. Symptoms of Mpox. After being infected with Mpox, it typically takes 5 to 21 days for symptoms to appear. The initial symptoms often include high temperature, headache, muscle aches, backache, swollen glands, shivering, exhaustion and joint pain. A rash usually appears 1 to 5 days after the onset of these symptoms. It often begins on the face and then spreads to other parts of the body, including the mouth, genitals, and anus. Some individuals may also experience anal pain or bleeding. The rash is sometimes mistaken for chickenpox. It starts as raised spots, which develop into small fluid-filled blisters. These blisters eventually form scabs that later fall off. Symptoms generally resolve within a few weeks. However, during the symptomatic phase, you can transmit Mpox to others. Preventing Mpox. While Mpox is a rare infection, taking precautions can help reduce your risk of contracting or spreading the virus. Here are some key prevention strategies. Avoid physical contact. Refrain from close physical contact, such as touching someone who has visible symptoms of Mpox or who exhibits symptoms consistent with the virus. Practice good hygiene. Wash your hands frequently with soap and water, especially after contact with potentially contaminated surfaces or people. Use hand sanitizer if soap and water are unavailable. And disinfect surfaces regularly, especially if someone in your household has Mpox. Avoid sharing personal items such as bedding, clothing, and towels with someone who has Mpox. And avoid sharing personal items, such as utensils, toothbrushes, or razors, with others. Be cautious with wild animals where Mpox is prevalent, particularly with rodents like rats, mice, and squirrels, as they can carry the virus. Also, ensure that any meat from any animal in the affected regions is thoroughly cooked before consumption. Stay informed. Keep up to date on travel advisories and outbreak information if you are planning to visit areas where Mpox is more common. And keep informed about local health alerts and follow any recommendations from health authorities. By following these precautions, you can significantly reduce your risk of contracting or spreading Mpox. We hope you found the information in this video useful.